Hello guys, welcome to my YouTube channel Legend Pharmacy. As today in this video, a simple concept we can try to understand. See, that is fever. You know that what is fever, and here let's discuss about the important characteristics of the fever. Is this fever is essentially important for our body? Is it leads to any danger situations, any ICU situations? That we discuss here. And let's in addition to that, causes, symptoms, diagnosis. How can you diagnose the fever? Then treatment also we will discuss. Some of the NSAID tablets are there, antibiotics also are there. I will tell you why antibiotics, when you have to use antibiotics in fever, and fever is good or bad, that too we will going to discuss in this video. So watch the video until last. Yes, a fever. See, generally body temporary increase in average body temperature. Okay, we know that our body temperature is 37 degree. If beyond that 37 degree Celsius, if our body temperature raises, that leads to fever. 98.6 degree Celsius. Okay, that is the in Fahrenheit. If it cross to 100 or 102, then it may lead to fever. Now, why this variation in the fever or in temperature means, see, in our body, hypothalamus or thalamus will maintain the fever level, temperature especially, temperature level. If any alternation in our body, why alternation means because of the infection inside the body. Okay, why fear will comes means because in our body cells, that is a WBC immunity cells, what they are doing, they are fighting against the infections to fight those with the foreign particles. While fighting, no, there is a disturbance in temperature. For that reason we are suffering from the fever. So if fever comes means we have to understand that immunity mechanism is takes place in our body, that immunity inside our body playing a role, that we have to understand. Simple, this is the fever. And the a fever is usually caused by the infection, yeah. Then an infant, usually lower fever leads to severe infection in infants, in children's. Lower fever, that is lower fever means 90 100 degree Fahrenheit or 99 degree Fahrenheit, it's normal. 100 degree Fahrenheit or 37.5 degree Celsius. Okay, this time you have to meet to the doctor, because in infants this a little bit raise in temperature leads to some of the complications. When to see a doctor, it is also very important. See, infants and toddlers more than younger than 3 months old, if the baby is 3 months old, then temperature of 104 degree or higher, then you have to call for the doctor. 104 degree, okay, that is 38 degree Celsius or higher, that time you have to speak with the doctor. Between 3 and 6 months, 1 or 2 degree Fahrenheit or 38.9 degree, then you seems to meet with the doctor. And between 7 to 24 months old has a rectal temperature. Rectal temperature means we are measuring the fever with the help of the thermometer. That thermometer will place in the rectum, so that it can take a good measurement. 1 or 2 degree Fahrenheit or 38.9 degree for 2 years baby. At that time, if the fever ranges in this range means we have to call for the doctor. Okay, and causes is simple causes are there, you know that like some of the viral infections, bacterial infection, heat exhaustion. Viral infection, bacterial infection, heat exhaustion means excess heat removed from the body, and trauma, that is cancer cells, some drugs like antibiotics also, and vaccines also. In coronavirus, you are familiar with that. After vaccination, the vaccine those who are doing vaccination, no, they will write you paracetamol 500 mg. Why? Because of these vaccines, what they will do, vaccines, they are the inactivated form of the dead cells or dead microbes. If we insert in our body means what happens, our body will fight with those vaccines or with those dead cells, so that to gain the immunity for the active cells. So that immunity action leads to the rise in temperature. So for that reason doctors are writing paracetamol after immunization. Are you getting? Yeah. Next is the symptoms, sweating, chills and fevering, headache, muscle ache, weakness. These all are the symptoms. Diagnosis, how can you diagnose? By seeing only, by seeing the temperature with the help of the thermometer only we can diagnose, and person itself can diagnose that he is having the fever. He will feels inside, means some shivering he will feels, he will feels not good. These are the some diagnosis technique. And for better, what they will do means they will take some of the physical tests like nasal or throat samples, okay, for respiratory infection. If there is any sort of respiratory infection means, if the fever won't goes in 3 to 4 days, then the doctors will take the respiratory tract infections, or they will take the swab so that they can test. And also they will go for the blood test also. Blood test also. And treatment, no treatment required for low grade fever. Low grade fever is no treatment required, but greater than 1 or 2 degree Fahrenheit requires the treatment. What treatment? A simple treatment is this: paracetamol 3 times a day. Okay, if you are adult, 650 mg. For babies, you can give drops on the and for infants or for the above 1 year age, you can give syrup form. 1 to 10 year 12 year you can give syrup. From 12 onwards you can easily provide the tablet. 500 mg paracetamol, 650 mg paracetamol. Ibuprofen also you can provide, but aspirin you cannot provide in the children's because it leads to the blood thinning agent, these aspirins. Then drink plenty of fluids, especially water is very important. Drink clean water, good water, and also ORS. You have to maintain the oral rehydration salt. And vitamin C tablet BD 2 times in a day we can take. Rest is very important. Stay cool, don't be hike. And also IV in infants, if the fever is very critical condition means, then doctor will give IV routes for the children. So okay, some of the antibiotics also be given for those who are tested for the bacterial infection only. Okay, especially fever can be through bacterial or viral infection. If viral infection is there means the fever cannot be treated with the antibiotics for viral infection. These antibiotics are only treated for the bacterial infection. If the bacteria is attacked means at that time only. How can we get some of the tissue culturing test, blood culture test, respiratory tract infection test? Okay, these by performing these diagnosis test, the doctor will indicates that he or she is suffering from bacterial or viral infection. Are you getting? Then fever is good or bad? See, basically fever for some extent is good, because it indicates what it indicates, that body is fighting with infection. This is one of the very important. This is one of the very important. Remember one thing: illness, fever, it is not a disease, it is not a type of illness, it is a symptom which is generated due to the infection. Simple. Okay, you understand this fever, very important one, fever thing. And you have to go for your diagnosis, symptoms, causes, and some of the information on the fever. Thank you.